record for those that were unable to attend. And I'm going to go ahead and share. Let me open up my PowerPoint here. I think that will work. Okay, let me move this over. And I've got just a few really short slides that I wanted to cover before we introduce our speaker and get started. And so, of course, this is our third of 6 sessions. We're going to cover mechanically assisted secretion clearance for weak and/or ineffective cough. And we have a guest speaker, Dori Weber, registered respiratory therapist. And as usual, we have our disclaimer. This presentation is based on patient perspective and reading medical literature. Although this particular presentation, we do have a guest speaker this time. And of course, not that you would, but don't use this presentation as a substitute for medical care. And always seek medical care for breathing muscle weakness from a licensed clinician who specializes in the breathing issues of those living with neuromuscular disease. And I just wanted to start out briefly to mention cough insufficiency and neuromuscular disease. Just like those muscles used for moving air into and out of the lungs, those same muscles used to cough, they weaken and they can get contracted, leading to what is termed cough insufficiency, which is basically just a big term meaning weak and/or ineffective cough. And it's cough that helps us to clear inhaled foreign materials, aspirated foods and/or liquids, and retained or excessive mucus from the airways. And I wanted to share this quote just to kind of give us a point of reality. I know this is from an older article, but most of us that have interacted with many in our community know that this pretty much still stands to be true today. And that's that approximately 90% of episodes of respiratory failure within patients with neuromuscular disease occur during otherwise benign upper respiratory infections because of the inability to clear the airways. The benign that they're referring to here would really refer to things like the common cold. So most of us either know from personal experience or having others that we know that get a cold know that it can very rapidly escalate to be something significantly worse, even pneumonia. And another quote I wanted to share to give you an idea of what peak cough flow value on pulmonary function testing would let us know that you need assisted cough. This quote, again, another older article, quite old actually, but it continues to be referenced in newer medical literature. And it basically says that a peak cough flow value of less than 270 liters per minute, that's what's been established as the minimum level necessary to be able to clear secretions. And this one just reminds us that respiratory muscle strength can deteriorate during respiratory infections. And I think that's something that a lot of us don't really realize. We may not necessarily, based on our peak cough flow, initially look like we qualify for cough assistance, but then when we develop a respiratory infection, we're so close to that number that then we're really in trouble and we do need that assistance. And then finally, I want to introduce our speaker, Dori Weber, RRT. She is a member of the American Association for Respiratory Care and the Virginia Society for Respiratory Care. She graduated as a certified respiratory therapist in 2007, and she became a registered respiratory therapist in 2008. Most of her clinical experience was in the hospital setting in adult critical care, neonatal, and pediatric intensive care, and the ER. She has worked for Med Inc., a Rotec company, for a little over 3.5 years, performing patient assessments and in-home visits, and 2.5 years of that with neuromuscular disease patients. Her initial focus was on COPD patients' respiratory needs to help them stay out of the hospital or reduce frequency of admissions, and this then expanded to include neuromuscular disease patients. She works with several neuromuscular clinics in Virginia as a provider of non-invasive ventilatory support, invasive support, and cough assist and suction equipment support. She works closest with VCU's NeuroClinic program and ensures patients have the tools that they need to utilize the supportive equipment they've been prescribed. She educates, troubleshoots problems, and provides feedback to the clinic when needed. And so at this point, I'm going to turn it over to her for a little bit of discussion about mechanically assisted cough, also known as insufflation, exsufflation.
Hi there, I'm Dori. Thanks for the nice introduction. And to simplify things, because the inhalation, exsultate, whatever, is very difficult. I like to keep things simple for my patients. We utilize something called a cough assist, and I realized, I'm not trying to represent any particular device or company or anything like that, but when you look online, basically Respironics T70 is about it. There are some older models out there, and I'm sure there are some other devices out there as well. I know there's a machine called Voxen that has a cough assist function on it. I've had minimal experience with that, and it just wasn't the type of thing that we were comfortable using. I had never used a cough assist on anybody in the hospital. The only place I've really seen it is over at VCU in the hospital. But I've come to understand how it works and really how important it is to my patients with neuromuscular disorders. The one thing I've found with our patients is everybody tells me they're breathing just fine, no issues. But if you were to really take a look at not only their vital capacity numbers, that's something that we follow and trend, or perhaps they'll tell me they never cough anything up. Well, I don't know about you, but when I get up in the morning, I don't smoke. I don't have any issues going on. I do have some allergy issues. I cough things up on occasion, but a lot of my patients don't ever do that, and they look at it as a good thing. But to me, that says maybe you've got some secretions that are pooling in the bases of your lungs. And you really need to make sure that those are being mobilized. If not by using a cough assist, but by getting good deep breaths. A lot of folks need some additional respiratory support to make that happen. I look at our lungs, all of the important gas exchange, getting oxygen into the system and CO2 out, which that is basically oxygenation and ventilation. That gas exchange happens in the bases of our lungs, and we use our diaphragm, the biggest muscle in our body, to make that happen. Every breath we take, that diaphragm is working to pull air into our lungs, and then exhalation is passive. But what my neuro patients don't realize is those muscles can weaken, and you don't even realize it because our body is so awesome at compensating. Instead of taking 10 breaths a minute at, just to pick a number, at a volume of 500, it's going to breathe 20 times a minute at a volume of maybe 250.
Yeah, shallower breathing.
Yep, and so your breathing is more shallow, and you're not moving enough air to make those secretions move around. I could listen to your lungs and not hear anything, because that I would say indicates secretion removal is needed. I'm not hearing anything because you're not getting enough air to those bases to move those secretions. And I learned that really just through patient care, not thinking somebody's fine and finding out they have a horrible pneumonia and they've ended up in the hospital. So I try and preemptively tell my neuro patients, I know you feel fine, and I hope that's, you know, that's true, but you've got to be aware that things are going to change. And as you had said earlier, throw a cold on top of that, or just a normal respiratory virus of some kind, and it can put you into a tailspin. So one of the tools that we use is the cough assist, which is an easier term for it, I think.
Mhm.
I'll try. I'm not sure what the best. Well, I guess you can
Yeah, we
kind of
can
see
see
that
it.
from there. Yeah,
Uh-huh.
I brought tools. Um, this is the actual device. It looks like a little TV set. Um, it has a bacterial filter. Oh, let me get this a little bit more over here. It has a bacterial filter on the side
Mhm.
that comes off and can be removed. The bacterial filter can be replaced regularly, particularly if you've had an illness or perhaps gotten secretions into your tubing through use. You know, you always want to maintain clean equipment. This hose actually detaches from there and is washable. And let's see, can you see that?
Uh-huh.
This
A mouse.
actually
Mhm.
attaches to a mask. And I see we've got folks through the spectrum here that, you know, maybe the mask isn't the best fit for you. What this does with a tight seal is push air in and pull air out, cycling through that motion. I call it a plunger for your lungs. It literally in, out, in, out. That action pumps more air to the bases of those lungs where maybe you're not getting that movement generally, gets that moving and helps pull it up. So, and I'll go over what the cycle is and that type of thing, but I wanted to show you the different interfaces. This is for, you know, covers the nose and mouth. You can actually add, I don't know if you can see it, you can add some air in there with a normal syringe. You want to hold it in place, kind of like this, so you're getting even pressure. You want to be careful not to put too much pressure in any one place because it hurts if you don't do it right. This makes it nice and even. For somebody with a trach, literally, this might not fit your trach, but with an adapter, it would fit right over the trach, or even attached to a Ballard suction. I don't know if anybody is aware. Ballard suction is an inline suction that's in a bag. Yep, I see you. I
Lena
know
has
you.
it.
Hi there. A few familiar faces. Anyway, you can use this in conjunction with a trach interface or through the use of the Ballard and then suction secretions away that come up. I have not personally used this, but mouthpiece. So for
Mhm.
somebody who maybe doesn't have the hand strength to hold it in place the way you would want to, you can literally place this in your mouth, assuming you can make a tight seal with your lips, and maybe use nose clips on your nose so that that air that's going in, you know, isn't escaping through your nostrils, and
Mhm.
that and then it allows for the suction to help with that motion back and forth. And you said you use that?
Yes, I do. That's all I have ever used. I went to get my Cough Assist T70, the very model that you have,
Yeah.
met with my respiratory therapist, and the look on my face, I know my husband distinctly remembers it. When he put that mask on me, I freaked out.
Panicked. Yeah.
I could not stand it. And he said, "Well, wait a second. Let me look at your notes here." And come to find out, my doctor had actually ordered it to be used with the mouthpiece, and
Oh,
he
how
had a
cool.
mouthpiece kit
Well,
that was
now
in
that
the
you
bag.
say that, now I'm going to make sure that I at least offer this to some of my
Mhm.
patients, because you're right. It's a scary feeling. People,
Yeah.
nobody, it's like, what are you putting a mask over my face for? And you
Yeah.
need to create a seal, and it can be difficult to have the hand strength and coordination to do that.
Yeah. I felt like it was gonna just suck my face off and blow away too. I was struggling to hold it. But I
Well,
think,
I did a little homework before I came to talk to you all today, and it does say to start at really low pressures, even
yeah.
lower. I usually start at a pressure of 20. And I know that doesn't really mean
Yes,
anything to
that's what I
anybody,
did too.
but they actually say to start at like 10 to 15 and then gradually build up. So that's something to keep in mind if you have that kind of panic moment. But think about how you feel when you have something to cough up and you can't.
Exactly.
So what I really try to stress is, okay, I know you think you're breathing just fine, but get used to this. Start using it, at least once a day. I know through clinic, they recommend 3 times a day, but the reality is anytime you feel you have secretions that you can't get up on your own, sorry, then it's okay to use it. But a doctor will normally prescribe. A doctor will normally prescribe a frequency and also settings, but just because they prescribe settings does not mean that you're going to be able to use them at that setting. So you might have to build up to it.
Yes.
I'm really glad to
Weeks
hear that you
to months.
do you use the nose clips?
I have them. I usually ask for them when I go have a PFT because they just throw them away anyway, so
Yeah,
they'll give
true.
them to you.
Okay.
But oftentimes, unless I'm really sick, I'm able to seal my lips enough over that mouthpiece and kind of close off
Okay, close
just
off
the
the
back of my
airway.
throat and don't feel like a lot of air comes out. But I know some of us just don't have the bulbar muscle strength to do a mouthpiece,
Yeah,
or
yeah,
they can seal their lips, but then they report lots of airs coming back
yeah,
out, even if they
yeah,
use
yeah.
the nasal
So it
lips.
really,
Those
it's
clips.
individual based on, what are you capable of doing? What might you need help with? And I know a lot of my patients, they don't want to ask for help from somebody else if that's something they can do on their own, because they know there are a lot of demands, and it's understandable. But sometimes you have to come to the understanding that maybe this would be a good thing to get help with, so that everybody's comfortable with using it too. When I use, and I'll turn this on and it'll make a bunch of noise and I'll show you more things, but when you're using the Cough Assist, it's a really good idea to have a suction machine handy, because not everybody can get secretions up and out on their own. And I didn't bring a suction machine home and it would have sounded like a motorboat had I. So, but this is a yank hour, which is fine for oral secretions.
Yes.
And not so much for with the trach, but you've got your own suction available for that with the Ballard. It's important to remember when you're removing secretions with the suction machine, you want to go on the side of your mouth, maybe in the front. You've got to be very careful going across the back of your throat. You don't want to cause somebody to gag, okay? And before I turn on and show you settings and that type of thing, let me move this over a little bit. I feel like you're looking at a box. There. One of the things that's important to remember, if you're choking on something, you do not want to turn to your Cough Assist, unless you're choking on secretions. If you're choking on a food or a liquid and you use the Cough Assist, it could shoot that debris into your lungs, which could result in a pneumonitis, which is not fun. That's an inflammation of the lungs and is going to cause problems and is going to increase secretion. So definitely want to pay attention to why, what is going on. And, it's different if you're choking on secretions that you were trying to cough up but can't get quite all the way up. It's fine if they're going back down, but you don't want, a ham sandwich going down there, or a soda, or a glass of water, or whatever. The other thing to keep in mind, this is pushing air into your lungs. That's right over your belly. So if you've just had a big old meal, you don't really want to use the Cough Assist right after that. So I tend to tell my patients, try using it like first thing in the morning, before breakfast. And then maybe an hour or two before you go to bed, if that's not too close to a mealtime. Some of my patients are on tube feeding, so you kind of have to work around those schedules. You know, can be difficult, but you can figure out where and when is best and what works for you. Trying to think what other, those are really the big precautions that I always tell people about when they're using the cough assist. So with that, let me turn this thing on. We talked about being able to get the suction machine going. I'm going to use the the mask for right now. One thing you want to remember, you got to stay clean. You know, if you're using this, maybe clean your hands before you get ready to put them all over somebody else's face or your own face. The device, let me get this back into the screen. I don't know if you can see, but when it's plugged in, this little on-off light lights up. Generally does not, it doesn't run, let me rephrase this. It can run on battery. Batteries are expensive, and usually insurance, unfortunately, doesn't cover them.
I had to
But
purchase
if
mine
it's
out of
something,
pocket.
yep, if
Yeah.
it's something that you need, you know, you can get one, and it does attach on the back. Generally, when we lease them out, we don't provide them.
Just quickly on that with the battery, what I was able to do was I told my respiratory care provider that I rent my Trilogy from that I needed one and I wanted a quote for a price.
Right.
And it ended up taking a lot longer, but they went through an approvals process and they ended up approving, I think it was at the corporate level, they had to get approval for me to be able to purchase it at cost. So there was no markup on it. And so it ended up being, I want to say it was like $170 something versus if you Google and look for that battery, which is the same battery that works in the Trilogy 100, you could spend anywhere from $300 to $600, maybe even $700. So just a tip.
The insanity of the pricing of it is unbelievable. I wanted to say, I had checked into it, and of course everything changes, but I want to say about $275, I think, was the out of pocket that I had been told from our company.
Okay.
Excuse me, but again, who knows with inflation where we're at right now? I don't know if that number is going to be different. So this can run on battery. Otherwise, it's got to be plugged in. So it depends on how mobile you are and whether you're taking it with you and how often you really need to be using it, whether you'd want that battery or not. Nice to have the backup though. And if you do have a Trilogy 100, it is the same battery that's on that. So anywho, as you can see, there's this little on-off switch here. I'm going to turn it on. And lo and behold, screen lights up. And I don't know, can you see the numbers that are on here? All I see is a white screen. Let's see.
It may be that if you tilt it a little bit downward, it might just be the light angle. Actually, now you can see it a little bit better.
Okay, oh, well, this
will be
cool.
Closer.
Well, let me see if I can get it to stay like that. Well, I don't know. Sorry. There. Okay. That, because I want you to be able to see the screen to see what I'm talking about with the pressures. Right now, in the top corner, I have 3 different presets on this machine. I just do a low, medium, and high. Settings are going to vary based on a patient's needs. So remember, we said we usually start on something low. So I have a negative pressure of 20 and a positive pressure of 20. That means it's pushing in that much pressure, pulling out that much pressure. I can control what the timing is on all of that, whether it's 2 seconds or 1.5 seconds or whatever works for you. So that's the kind of thing that whoever is setting this up for you can work out with what's most comfortable for you. I always recommend putting the nose and mouth behind the mask okay, holding it firmly and hitting the therapy button. Here, let me show you what that is. You see settings, menu, therapy. So we're going to hit the therapy button, and I try and time this with my patient saying, okay, get ready to inhale. And it's going to push air in and pull air out. If you've got a good seal, you're going to see the blue line and the yellow line go to what your setting is. So I'm on a pressure of 20. I'm getting 20 of positive pressure and 20 of negative pressure. That means I don't have a big leak. If I had a big leak, you're not going to get that, see? And you're going to feel that air rushing out around you, okay? Because it's noisy. I'm going to turn this off for a second. So when I want to pause, this now says standby. I press that button, and now I'm in standby mode. So I'm going to turn this off because it's kind of loud, okay? I'll turn it back on in a minute. So you want, let's see, each person, you're going to do 4 to 6 cycles of those breaths, that in and out. Both the pushing in of air and pulling out of air is 1. You want to do that 4 to 6 times, whatever you're comfortable with. Take a pause, try and cough, see if there any secretions are able to be cleared, and then repeat that cycle another 4 to 6 times. That's considered a treatment. It really doesn't take very long. And if you're successful on clearing secretions after your first or second round, well, woohoo, you're done.
Yeah.
Wait
Yeah,
until
you're at
later.
that
I
point.
mean, yeah, the whole point is help you mobilize and expel secretions. And if you can remove them without using the suction, great. But if you can't, help yourself with the suction machine.
And would you say, Dori, if we don't mobilize those secretions, if they stay in, it basically sets up an environment where bacteria can multiply, and then we can quickly have an infection.
I call it the swamp. I refer to our lungs as the swamp because we all have secretions in our bases. But generally, when everything's functioning well, we can breathe in enough air and keep them moving and cough them up and expel them as needed. But as your musculature weakens, you can't and you don't. And, you know, just like the swamp, you know, it gets infected. And that's where you get into trouble with pneumonia and possibly hospitalization. And nobody wants that. You know, the better you can maintain that environment within your lungs, the better for you. See, secretions. But like I talked about with our breathing, the diaphragm is the same muscle that you use to cough. When you inhale before you cough, which is what we do, it's a cycle, just like what the machine provides, you're taking enough air in and then forcefully pushing it out. And as your muscles weaken, you don't have an effective cough. So this kind of replaces that and helps maintain that function and hopefully keeps people out of the hospital. That's the main goal. And, you know, I call it a plunger. It's like a plunger for your lungs. It pushes air in, it pulls air out, and helps keep those secretions moving around and hopefully gets them up and out for you. I'm trying to think. It prevents a pneumonia, but it also, if you're coughing 20 times to get your secretions up, it's exhausting. It's called work of breathing. And if you got to work that hard to get those secretions up, it takes away from the energy you have for other things. One of my patients told me that his doctor said to him, think of it as a gas tank. You know, you wake up in the morning, you've got X amount of energy. You can put the pedal to the metal and go like crazy and burn it all up really fast, or kind of pace yourself throughout the day. I think the Cough Assist helps pace yourself so that you're not exhausted. Just like I did see, well, I know one of the folks watching is on a Trilogy, and I saw somebody else connected to a device to help with their breathing. Just like you need that support to help you with your breathing, you need that support sometimes to help with a cough. And you might not need both. You might need one and not the other, and that's fine. But track what levels your breathing is at. Think about, gee, do I never cough anything up? To me, that's a red flag. And something that, or do I feel like I'm constantly getting things partway up, but not all the way? It might be time to talk to your physician or whoever you're following, neurologist, and say, I just don't feel like I have an effective cough anymore. And that is something that can change. And especially with an illness, you might definitely need it then. And to me, I'd rather have it before I actually really, really need it, not only to maybe prevent a pneumonia situation, but so that I'm comfortable using it. It feels very different. It's an odd sensation to have that plunger in and out of your lungs. One of the things, if you're using this with a mask, you kind of want to keep your mouth open and breathe in with it and out with it. And that can take some time to get that cycling so that it fits your needs and is comfortable for you. But it's worth taking the time to figure that out. And let's say you've been doing this lower level, but now you've got a cold or something's brewing or going on, well, you might want to go to the medium level so that you're pushing things a little further than your normal comfort zone, just to clear those secretions.
And when you're referring to those different levels, Dori, you're referring to there's different settings that your provider can enable, and you can toggle between those within the menu. So like when I started, it was so many days at 20, only 20.
Oh, really?
Then I was told to incorporate a few 20s, but add a couple of 30s. And we just kept increasing. And then eventually I was doing mostly 30s, but some 40s. And I was toggling back and forth between those preset settings.
And it's easy. I always set my patients up with 3 presets, a low, medium, and high. And the 20 is probably pretty low for most people. 30 is probably maybe your goal. And when somebody is more comfortable on the 30, I'll switch all the presets, and 30 becomes my main. And then we'll do a 40, 45, or even a 50. I've had patients who want pressures even higher than that. Not many, but a few. Okay.
I'm in the upper 50s. Okay. And that all started, I was in probably the lower 50s. I had gradually worked up to that because I just found that after a while in the 40s and even the upper 40s, nothing would come up except for maybe once a month. And it was every single month it was that way. It was like I was just reserving it up. And until I had used it so many days in a row, then everything would come up. So, but I ended up getting really, really sick with probably what was the worst respiratory infection of my life. And I woke up at some crazy morning in the night with my ventilator on and suddenly started coughing and couldn't breathe. And I ended up having a small mucus plug. And I had to crank those settings up on the fly to the upper 50s. And through that whole illness, because the mucus was so thick, I know that's disgusting.
No, I'm a respiratory therapist. I live for snot.
This is just, reality here. But once I found that that's what it took to get that thick stuff up for the duration of that illness, I stayed in the upper 50s. And once I had done that and gotten past the soreness that was all in through the muscles between the ribs and the chest, then it reached a point where, well, I'm not sore anymore. Why don't I just stay on those high settings? And you guys will have a link to it in the handout, the presentation, where I talk about my personal experience and what I saw when I started using those higher settings, and also using the machine, not just twice a day, but 3 and 4 times a day, just the incremental improvements that I saw. It just kept things were getting better and better all the time.
Well, and I don't think people realize if there are a ton of secretions in the bases of your lungs, And our gas exchange, in with the good air, out with the bad air, oxygen and CO2, that all takes place in the bases. Well, if it's all loaded up with snot, to put
Yeah.
it bluntly, it makes it a little tougher for that gas exchange to take place. So anything that you can do to improve the ability to exchange air appropriately is a great thing. And it's really, I love hearing from my patients their experiences, because I'm not using this device. I'm trying to explain why it's important for my patients to use it. And as I said, many of them don't feel it's necessary. They don't need it. They're fine. And, you know, until they go to the hospital, and then they usually will listen. But it's so important not only to use it regularly, but to maybe test your limits, increase a little bit. You know, when you first use it and you're panicking at 20, you know, but maybe as you get used to it, move up a little bit, so that, you know, if you're not seeing results, keep going up on the pressures until you're comfortable and feel good about it. I think it's really important to have somebody else, if you're lucky enough to have somebody in your home who can also use the device, show them how to go from setting to setting, so that you've got some support when you're feeling, you know, puny because you're sick. You've got another person who understands how this works. I spend most of my patient visits talking till I'm blue in the face and hoping that somebody's actually, you know, listening and trying to use the tools that they have to prevent those hospitalizations and to improve their life so they feel better. You know?
Yeah, I think for me, I absolutely hated it in the beginning. I was
Sure.
the one
Who
that I
wouldn't?
was calling my respiratory therapist weekly. I was emailing my physician. I just could not understand. I was having a lot of pain, to the
Yeah.
extent where my pulmonologist prescribed lidocaine patches that I could
Wow.
apply on the chest. And the funny thing that happened to me was I had been on inhaled corticosteroids, and that was because I was having tightness that would develop throughout the day. The longer the day went on, the tighter I got. And so, an early physician that didn't understand neuromuscular disease, he had put me on those and had given me the impression that had basically diagnosed me with asthma. But long
Mhm.
story short, what ended up happening is the more I got used to Cough Assist and using it every single day, even though I absolutely hated it back then, something really strange happened. Suddenly, the tightness that I would start having in the middle of the day, I didn't have it. And so it took me explaining that to my first pulmonologist that specialized in neuromuscular breathing weakness,
Right.
and her looking at my PFTs and telling me asthma is an obstructive weakness
Right.
pattern. Your muscular dystrophy, breathing muscle weakness is restrictive. You have
Right.
no evidence of obstruction.
Right.
You don't need those inhaled corticosteroids. You just
I
need
just
to,
had the hospital send 2 patients home on albuterol and budesonide,
yeah, I
and
was on
I'm
all
like,
that.
you don't need these.
Yeah.
It's not
And
my job to tell you you don't need them, but please
she
talk to
had
your.
to convince me, and I had
Yeah,
to slowly taper off of those
sure.
and was off of all of them and no longer had those symptoms. But it was because I was using Cough
Sure.
Assist every
Sure.
day.
Well,
And
think about how exhausting it is for your muscular system, just breathing every breath. You're using your diaphragm, and then you throw out the ability to cough. Yeah, it's tough. You can't get those good deep breaths or the things that help keep things mobilized and up and out. For anybody who goes into the hospital for a surgery or whatever, the very first thing that they put in front of these people, even before they're awake from anesthesia, is something called an incentive spirometer
mhm.
that you suck in air. Okay, so, but that's work, which I don't want my neuro patients doing. But the reason the hospitals have that waved in front of their patients so early on is because by inflating the lungs enough, no matter how you feel,
Mhm.
it mobilizes secretions and prevents or helps correct a pneumonia. And
Mhm.
so really that cough assist is such an important part of that. And again, you've got to be of the mindset of understanding that no matter how great you're feeling right now, your musculature is struggling. That diaphragm, if you're having trouble moving your arms or your legs, well, your diaphragm's a big muscle too,
Mhm.
and it can be affected. And you don't know by how much, other than by having regular, we track vital capacities on our patients. I monitor end tidal CO2, and that's just a number, but I look at, is it increasing? Because if it's increasing, that means your ability to ventilate is decreasing and not as good. And I can't personally say, oh, we're going to do this, but I'll let the clinic know what I see, what's going on, to try and help you. I have a lot of patients who, when they go to sleep at night, and I always recommend my neuro patients sleep on an incline, not flat, to support their breathing. Most don't listen, but eventually they do. Eventually they listen. Their breathing usually is worse at night when they're trying to sleep. And a lot of patients have trouble sleeping through the night, sometimes because all of a sudden they're having all these secretions, maybe an hour or so after they go to sleep. The patients that I can convince to start using the cough assist, a good hour or two before bed, but again, allowing time after a meal, they start not having that incident in the middle of the night, and they can sleep for a longer period of time. So I see benefits and hear benefits from my patients' feedback all the time. So I don't know, what else do I need to go over? We talked about the suction machine. Best practices, again, stay clean, have a good seal, look at the pressures when you're doing this. If you'd like, I can show you how to cycle through, but that's really more of a personal
Mhm.
thing. If you would like me to, I can, but it'll be pushing buttons and that's all you'll see on the screen.
Yeah.
You want to keep everything clean. Don't be afraid to ask for help when you need it. That's a biggie. Nobody wants. I was raised by a mom who has passed away long ago, but her words were always, I don't ever want to be a burden to anybody. Well, you have people who love you, just like you would do anything for your loved ones, they will do anything for you. And if it means helping you hold the mask in place or, pull together the suction machine or whatever, allow them to do that for you, because it keeps you out of the hospital. Nobody wants you in the hospital. You don't want to be there. Your loved ones don't want you to be there. It's so important to use not only all the equipment tools you have around, but use the people who love you around you. That's a blessing. And not everybody has that luxury. I'm trying to think what else. We talked about the suction machine. And really, the whole reason for doing this is preventing pneumonia and reducing your work of breathing that takes place when you're coughing. Do you guys have any questions?
And we had someone was asking about what method of incline do you recommend for sleeping? We've had some in the chat say, one said I have a medical bed. Someone has an electric style bed, so I can easily set the amount of incline. That's
I
kind of like me. I have a bed on an adjustable base. But
Yeah,
before I had that, I didn't get that bed till 2021. I would just prop up on some additional pillows.
well, I always
That
laugh.
was a challenge.
I have 3 pillows behind me. I don't have neuromuscular. I just like all those big fluffy pillows. And you know what I end up on? I end up on 1 pillow.
Yeah,
So,
yeah, I slide real bad.
so when anybody says a wedge or extra pillows, yeah, you can try that. Good luck. I think something with an incline of maybe about 30%, 30 degrees, is a good starting point. Some
Mhm.
people, that's too hard. I mean, they need to be more upright. But that depends. Everybody's different. I can't, sometimes if you're on that angle, you end up just sliding down. So if you've got
That's,
something that
that's what I
can
do.
support you from, I mean, to me, maybe the wedge is better at your knees and with the incline up above. So yeah, I would say 30 degrees is probably what's recommended.
Does anybody have any questions for Dori while she's here? Actually, I see another comment here in the chat. Can it be used for tracheobronchial dyskinesia of the main bronchi? And
Somebody's using
trachea?
a lot of very big words for me.
Yeah, the bronchi are smooth and sag heavily when coughing, so doctors forbid me to cough. I usually use gentle methods of removing and draining sputum. Recently, it's become a little bit to use a mucus removal device with a fluttering valve with open technology. So I think she's probably talking about, I'm trying to think of the name of it, but those fluttering
Yeah,
devices, a lot of those don't go any higher than, and you probably know this more
gonna
than
say
I do,
20 or
like
30. And I
30.
can't, I've been out of the hospital so long, I have forgotten the name of it too. It looks like a horn, basically.
Yeah, but it
It's
seems
a,
like they don't go above 30 centimeters
well,
of
and not only
water.
that, but that would increase your work of breathing because you're blowing out against that pressure. So
Mhm.
and if you've been told not to use something, you know, it's certainly, I'm not going to come in and say, oh yeah, it'd be fine. That's something you've got to
Yeah.
work out with your physician. So I don't know the real answer to that. I really don't. You would have to maybe broach the subject with your physician and talk to him about a cough assist and see if that's something that would help you. The flutter device that you're talking about, you know,
Yeah.
I just, that kind of flies in the face of why I think my neuro patients should be using the cough assist.
Yeah, it kind of, my personal opinion on it is it's better than nothing. I know
Yes.
someone that they didn't have a battery for their cough assist and they needed to go back to work and they took
Yeah.
that.
Yeah. Oh,
In my
sure.
case, I am one of the things that's really good, and we'll talk a little bit more about this in our next session, is one way that you can augment a cough if you don't have your cough assist is breath stacking on a
Yes.
volume mode of
Yes.
ventilation.
Yep.
And mouthpiece ventilation is something
Yep.
that I've been at work before, away from home, away from my cough assist, and I kind of found in kind of a almost an emergent situation where I needed to cough and I couldn't cough, and I just stacked a few breaths off that mouthpiece. It gave
Yep.
me a larger volume of air, and then I could cough and
Yep.
get up what I needed.
See, that's, oh, I need to like bring you along with me sometimes because that's another thing, breath stacking. I talk to my patients about all the time. The only thing that I don't like about breath stacking, it's not the act of breath stacking, it's that folks have to switch to a different circuit unless they're lucky enough to have two machines. And some of my patients aren't. They have two devices and they can use the mouthpiece ventilation. And it's a wonderful tool, not only to help you with vocalization, but that breath stacking does kind of what the cough assist does. It gets more air to the bases of your lungs so that you're getting to the swamp, you know, you're getting that big deep breath in there that otherwise you probably couldn't do on your own. And that helps get things mobilized. The only thing missing is the suction half of the cough assist. So yeah, absolutely. Breath stacking with mouthpiece ventilation is a great tool to help in that respect. Also, for folks who aren't breathing as well, using some type of ventilatory support, especially at night, is to me a great tool when you're ready. It can be hard to get to that point. But again, what I am used to working with gives you a targeted volume for you to be getting consistently over a period of time with varying pressures. So it's not like one pressure over and over again, which depending on how your lungs are doing is going to get you a big volume or almost no volume. So what I like, and I'm most familiar with the Trilogy, but I know there are other devices or pieces of equipment out there, but I'm a big fan in terms of what I've seen that it can do to support to support my patients. So it's a lot of different tools, but they all go to do the same thing: support your work of breathing so that you're not exhausted, to mobilize secretions so that you don't develop a pneumonia, and to help you expel those secretions without overworking your body, so you can go do something else.
And what I find is I use my cough assist literally, like if I have to do a big presentation, like some of these, like our previous sessions when I had to talk a lot, I will go use that cough assist a few minutes before, and it's an energy booster for me. But now you got to be one of these people like me where you use it every day, and then you will eventually find that that it will do that for you. You know, with the occasional use, you're probably not going to see that it gives you an energy boost. It's using it every single day. And I know I'm weird like that. People laugh at me that I love the cough assist, but I will be first to tell you that I absolutely hated it in the beginning.
Oh, and I think and who wouldn't? I mean, I think everybody does. It's all new. One of my favorite neuro patients, their saying was their neuromuscular disease sucked, and it does. Nobody asks for these illnesses or this disease process, but you can improve your day-to-day life by utilizing the tools available and making the best of every moment, you know, that you can. And there are good moments out there, no matter what stage you're at, but use the tools that you have available. And if you don't feel you have all the right tools, then maybe it's time to go back and talk to your physician and, you know, say, hey, I feel like I'm missing out. I feel like I could do better, or I could feel better, or make the best of where I'm at. So I always say, live each day to the fullest, because none of us are guaranteed tomorrow. We don't know. You don't know what your muscles are going to do tomorrow. I don't know what can happen to me tomorrow. None of us do.
I've got a quick question.
Sure.
So you made the point of not using the cough assist when you're actively choking. But what about if you, like, after you've choked or aspirated, like after it, like, you know, something's gotten into your lungs and you need help clearing it out to prevent it from sitting there and developing into an aspiration pneumonia?
Yeah. You know, and I don't think I have a hard, fast, good answer for you. My fear of using it when you're choking is because you don't want to push things further down into your lungs. So, you know, at that point, you may want to work off. It depends. You know, if you're a trach patient, you could probably suction something back out. Otherwise, you know, once it's down there, you know, I guess after the choking spell is over, you could try, but I would check with your physician on that one. I hate to give an answer that I'm not certain of, and I'll be honest, I'm not certain. Yes, in theory, you could help pull that up, but I think once it's down in your lungs, it's kind of probably too late.
Any other questions? And I didn't catch who our iPhone person was that joined, because I check off who attends and who doesn't. So I chatted. I don't know if you noticed in the chat box, whoever the iPhone person is, I chatted to ask you. Okay, so I got it. Thank you so much. That way I know who's with us. Any questions? Questions about use, tips for use? I know one thing. I think that mask comes in different sizes.
Yes, small, medium, and large. You don't want to overinflate the cushion, because that actually makes it harder to get a good seal, but it might need, like I noticed the one that came in the packaging that I opened up for this today probably could use some more air.
Is there a way to reinflate it if it gets deflated, or do you just have to get a new mask?
Yep. Nope.
Because I feel like mine has gotten super deflated.
Yep, this
Yeah.
is, and air temperature is going to change how inflated it is, but
Right.
this isn't the right kind of syringe, but there's a syringe that's got a Lorlock tip, and that fits right into, I don't know if you can see it. See right there?
Mhm.
The Lorlock syringe fits right there, and you can pump some extra air into it.
Okay, is that just something I asked my RT for?
Yeah, or
Okay.
depending on what other things you have around the house, you might have a syringe like that.
Mhm.
Right.
Cool.
I just want to say thank you because again, just like what Andrea was saying, and nice to see you again, Dori.
Nice to
Um,
see you too, Lita.
Yes, definitely. You need to use it. You need to use it, use it, use it, use it. As
Yeah.
much as it's uncomfortable as it can be. Because, like, again, initially when I first started using my BAPAP, they wanted me to do a full face mask because I'm a mouth breather. But I could not tolerate it all. So, we went through and I ended up getting I think it was the Mirage. They had the nasal pillows
Yep.
that works
Yep.
for me. So
Yep.
by all means, ask questions. Ask them, do they have something else? Because
Right.
again, if we don't know that there are different options, we won't ask about different options.
Yeah.
And I'm here to tell you, there are different options.
Oh my
out
goodness. There are so many different types of masks, and even the full face masks are different now and a lot easier to use. I look at, because we have in our supply, we have masks that, let's say, patients that have been around for a long time have used, so they still want the replacement of what they're used to. I wouldn't start a patient on any of those at this point, so things change and the interfaces change, even with the nasal pillows. People who don't tolerate having the nasal pillows right in their nostrils, I will try, it's like a little triangular mask that just goes over their nose, and that's more comfortable for some. There are full face masks that just cover literally the tip of the nose instead of the bridge of the nose. And for some folks, they need the full gamut. They might need a full face mask of some kind at night when they're sleeping, but during the day, if they need support, they might just need a nasal pillows or a nasal mask of some kind. Then they can they might have lower settings for that to support them while they're awake. But then they can wear their glasses. They can easily remove it for a minute to, take a sip of water without having, that flow shoot the water down their wrong pipe. Yeah, there's all kinds of resources and different types of interfaces. And that's the most important thing, is figuring out what will work for you and giving it the opportunity to work. And, I'm not a proponent of drugs in patients, but if your high anxiety level is to the roof, you may need to talk to your physician about, I just can't because I panic. You've got to keep trying, keep easing into it. And if you really still can't, maybe talk to your physician about something that might help you be able to tolerate that, because you got to breathe.
And don't wait till you're sick to request one.
Yes.
Go
Yeah.
ahead and try to get it now,
Yeah.
because you're going to have insurance approval.
Yep.
The company's going to have to order it,
Yeah.
the equipment, they're going to have to
Yeah.
deliver it, train you. You're going to want to get used to it
Yeah.
before you have an illness
crisis.
and you need it to keep
Yeah.
you out of the hospital. That's what I always tell people through Breathe with MD
Yeah.
Inc. when they reach out.
Well, and it's just so important to gradually build into any of this. Nobody likes something new. Nobody wants to use any of our equipment. I get that. But better to be comfortable with it and understand it, so that as things progress, you're ready. You know what tools you have, and you know how to use them, and you're not afraid of them anymore.
Yeah. And using them every day, you won't forget,
Yeah.
like one of the things that I know I'm preaching to the choir on some of this stuff, but I have a suction machine that I got after a really bad respiratory infection, when the cough assist was doing a great job of bringing things up to the back of my throat, but I couldn't hardly get it out. I was literally using things like paper towels to reach in there and try to get stuff out. I mean, that's just really crude and gross. but
And
and
quite common. So yeah,
And I'm-
actually, no, it isn't.
I'm
Yeah.
guilty of not using that suction machine very often. And it occurred to me recently, I haven't used this thing in years, but I've got it. I better get myself familiar with it, because if I were
Dust
to
it off.
yeah, dust it off. Thankfully, it's in a case. I think it's even got a battery for it. But
Yeah.
anyway, but yeah, I mean, I see people doing that all the time with Cough Assist, but I'm telling you, I'm bad with the suction machine. I don't know that I would remember how to use it. I'd probably have to call my respiratory
Well,
therapist.
you might have to give me a call.
Yeah.
And if it's the portable one in the bag that runs off battery, you need to have it plugged in for a good 24 hours to fully charge that battery. Once that battery runs low, you're doomed.
Yeah, it's plugged in. That's the
then you're
one thing.
good.
It is plugged in all the time.
I find them in people's closets, not plugged in.
Oh God.
It's like, okay, well, this isn't going to work now for a while. Yeah.
Definitely.
Yeah.
Well, thank you so much, Dori. This is just such fabulous information. So many nuggets of wisdom here, and just
Well,
great
thanks for having me.
information.
And
Appreciate
you know, stay in touch with your physicians so that you get the latest and greatest treatments out there and support. That's things change all the time, and you never know what's out there that might be helpful for you guys. And thanks for having me. I really appreciate it.
Yep.
All righty.
Thank you so much.
Thank
We'll
you.
go ahead and conclude, and I'll be sending everyone the handout and a PDF of the slides like I normally do. So you'll see that email. And just real quick, I want to remind you of I'm going to share the screen, our next session. Let me go one slide further. It is going to be a little less than 3 weeks from now, maybe just under 3 weeks, Saturday, March 12th, same time. We're going to watch some videos about lung volume recruitment and discussion, and it'll kind of pick up on a lot of what she covered here with us today. So hope everybody can join us then. All right.
Take care. Thank you all. Bye-bye.
Thank you. Bye-bye.
Bye-bye.
Mm.